the Neonatal Clinical Education Specialist for Respiratory Therapy here at MedStar, and basically I take care of small babies. Anytime that you give a patient oxygen, it can be for different needs, but there's cardiac indications, there's respiratory indications, sometimes it's surgical indications. For a parent who's coming to a neonatal intensive care unit, there's tape on the baby's face. Sometimes they may have a tube in that helps them breathe. Sometimes we have a whole apparatus that covers their heads, their nose, their eyes, so the parents aren't necessarily able to see the baby's faces. They're not able to see them smile or to see them suck because a lot of times their faces are so covered. I worry about their ears being covered constantly. I worried about their nares being stretched out that wasn't necessarily indicated, and the fact that you also could develop pressure points on their foreheads and on their cheekbones. So in order to be able to alleviate that, we changed to this particular device so that the babies could be treated less invasive. Now what we use is a set of prongs that are weight appropriate and doesn't cover their head or their forehead or their mouth. It just simply runs across the nose and then their face. So basically we looked for a way to make it easier for the patients to be able to see their babies' faces and to hold them sooner. If you haven't experienced, I'm going to get teary-eyed, but if you haven't experienced a family member being able to hold their baby for the first time, it's an amazing feeling. And you get as emotional as they do every time they have a chance to be able to have that first moment of holding. But we also do it every time they want to hold. We make so the babies are available for them to be held. And that's so important. That's a bonding for the baby and for the parents. I'm Cathy Hughes, Clinical Education Specialist for the Neonatal Intensive Care Unit for Respiratory Therapy at MedStar Washington Hospital Center.